Hi, my name is Brian Houk, and today I'm going to be presenting on bone injuries in youth athletes. So there are two common bone injuries that we're going to discuss today. The first one is an epiphyseal plate injury, and the second one is a stress fracture injury. The symptoms and treatment of these two injuries share similarities. However, they are different in the sense that an epiphyseal plate injury is typically a result of an acute event, such as a fall, car accident, or collision, while a stress fracture is the result of long-term overuse and chronic overtraining that commonly happens in endurance athletes or athletes who play the same sport year-round. As a coach, proper recognition, diagnosis, and recovery are important things to know about to ensure that you maintain the long-term and short-term health of your athletes. So first, we will discuss epiphyseal plate injuries. An epiphyseal plate injury is also known as a growth plate injury, and they happen at the ends of long bones. These injuries are particularly prevalent in children because their bones have yet to fully ossify or harden. So at the end of those long bones, such as the arm bone or the femur, those growth plates are made mostly of cartilage. It's more malleable than hardened bone is, so it's more susceptible to being deformed or injured from an acute event. There are 5 different types of growth plate injuries as classified by the Salter-Harris classification scale shown here. Type 1 is the least severe, and they progress in severity all the way up to type 5. So the type of the actual fracture affects the treatment and recovery protocol that will ensue. And again, most growth plate injuries are caused by collisions, falls, car accidents, participation in recreational activities, and participation in competitive sports. So what to know as a coach? Symptoms of a growth plate fracture include visible deformities, specifically a large lump in the arm or bruising. There may be a lot of tenderness, pain, swelling, or redness in the area, particularly near the joint, or inability to put pressure on the limb is another red flag that may indicate a growth plate fracture. The most common areas where growth plate fractures occur are in the fingers, arm bones, and the femur and lower leg bones as well. If you suspect that an athlete does have a growth plate fracture, this is a very serious injury and they should be referred to a physician as soon as possible. Ideally the day of, but no more than 2 to 5 days from the moment that the injury is suspected. A growth plate fracture will definitely sideline an athlete for several weeks. They will likely have a walking boot or a cast to help immobilize the injury and ensure they're resting properly. And the return to play process includes first and foremost rest of the affected limb, for several weeks. But there will also be strengthening rehab exercises and careful monitoring by a doctor to ensure that they aren't pushing it beyond their limit. So moving on to stress fractures. A stress fracture injury is a small crack or a hairline crack in a bone caused by too much repetition and overuse of the particular limb. Endurance athletes and those who train for one sport year-round are at higher risk for this injury than most other athletes. These injuries, as seen here, most often occur in the lower leg bones, like the shin bones and the foot bones. So it's important to understand that stress fractures are not the same as shin splints. Shin splints are less severe tears in the muscle that runs up along the shin bone, whereas stress fractures are more serious. What may start out as a shin splint can progress into a stress fracture, and a stress fracture is an actual crack in the bone rather than just the muscle or the joint. So symptoms of a stress fracture include chronic pain both during and after exercise, and similar to growth plate fractures, tenderness, swelling, or redness in the affected area. If you suspect that an athlete does have a stress fracture, they should be referred to a doctor as soon as possible, and they will ultimately be diagnosed with an x-ray. So a cast, splint, or brace will probably be applied for recovery, but surgery is rarely necessary unless it's an extreme case. And during the recovery process, athletes will need to rest and take pressure off of that limb. However, as rest continues and the symptoms lessen, then the athlete can progressively get back into physical activity with the close supervision of a physician and the coach. So in conclusion, coaches of youth athletes and those of endurance sports need to be aware of the signs, symptoms, and recovery process surrounding bone injuries to ensure that they maintain the long and short-term health of their athletes. One way to proactively do this is approach sport coaching with a LTAD framework in mind. This prevents overuse and allows athletes to play multiple sports so they don't overuse their limbs that are susceptible to those injuries. And lastly, create a culture where athletes can openly discuss injury concerns and are encouraged to heal fully before returning to play in order to make sure that they don't worsen the injury. Thank you for listening to my presentation.